Greetings, everyone, and thanks for joining me for this Cure for Cabin Fever Get to Know POE webinar. This is just one of the multiple presentations that we are providing today as part of our warm up with the Medicare Department's Medicare Education Expo. Months back when we began planning for this event, we couldn't possibly have predicted that on this day, many of us would be experiencing such abnormally low temperatures. I don't know about you, but I certainly have had a taste of cabin fever for the last few days. My name is Mary Muko. I am a member of the Provider Outreach and Education team at WPS, and I'll be your host today. I am joined by my friend and colleague, Jennifer Boniface, who will be assisting with some behind-the-scenes activities. But before we get started, I do want to remind you to review the disclaimers that I have placed at the end of the PowerPoint presentation. At the end of the presentation materials, there are some details on slide 32 that you should be aware of. The information that I plan to present today is current, but it is subject to change. So please note that, and also refrain from recording any portions of this presentation. We are actually recording the webinar, and we will publish it on our Encore Presentations webpage and on our YouTube channel. We are recording the presentation. If you do not wish to participate in it, you may leave the webinar at any time. So here then is just a little bit information about myself, a photo and a brief bio. As you can see, I have been working in Medicare for many years, and I am still learning and I am still enjoying what I do. I spent a great deal of time in the benefit integrity area before moving to provider outreach and education. The agenda for today is really pretty straightforward. It's for learners to learn about provider outreach and education, or what we call POE, our goals, and become familiar with the WPS Training Center and get answers to the most often asked questions that we in POE received. Now, this agenda should look very familiar to you, as these topics are the same ones that I placed in the description for this webinar, so you've likely already read through them when you registered for this webinar. I am going to start by sharing POE goals and CMS directives for POE. I'll provide a virtual tour of the training center on our website, and I'll give you answers to those most commonly asked questions that we in POE receive. So on to those goals and CMS directives for POE. Our goal is really to give our providers timely and accurate information that they need to submit and receive proper payment for Medicare claims. We want all providers to understand the Medicare program, be informed about changes, and be able to correctly bill. It is no coincidence that our goals align with CMS directives. An important piece of this is to listen to our providers and take into consideration their wants and their needs. So are you curious about why we do what we do? You can find why we do what we do in CMS directives. The directives for provider outreach and education, or POE, are included in Chapter 6 of the Medicare Contractor, Beneficiary, and Provider Communications Manual. This is just one of the many CMS Internet-only manuals, or what we call the IOM. The POE team integrates our activities with what CMS calls the Provider Customer Service Program. This is referred to by CMS as PCSP. The manual actually provides CMS instructions and expectations, and as you can imagine, this calls for a great deal of reporting of our activities and our results to CMS. You will find the POE instructions in section 20 of chapter 6, and you'll also find CMS customer service directives also, but those are found in section 30. And I do want to open up that chapter 6 of the Medicare Beneficiary and Provider Communications Manual and show you that information. Got it ready right here. I'm going to pull this over and show you that section of the manual. And this really explains why we do what we do. Why does POE do this and why doesn't POE do that? Why does customer service do this? Why doesn't customer service do that? POE instructions are manualized by CMS, and it's section 20. So you'll see various components of what we do and why we do what we do here in this portion of the manual. I went too fast there. I apologize for that. Moving back to the top. Partnering with external entities, provider education, talks about mailings, training, so on and so forth, meetings, reporting, charging fees to providers for education and training, and so on and so forth. And then you'll see beginning in section 30 of that Internet-only manual chapter, the information for the Provider Contact Center, which includes provider telephone inquiries and also written inquiries. Those sections of the CMS instructions are not a part of the directives for provider outreach and education. They're actually found in the instructions for customer service. So CMS directives for provider outreach and education are included in Chapter 6 of that manual that I just showed you, and it is just one of those many manuals, but this slide and the next one include a list of some of the tasks we do based on those CMS directives. CMS expects us to inform providers about changes so they have access to needed information to correctly bill. There is an expectation that we provide education to providers and to their staff. This includes many topics such as Medicare fundamentals. We also educate about policies, both national and local policies, and also procedures for preparation and submission of correct claims. CMS also expects us to share details about new CMS initiatives and also about significant changes that are going to happen. One other important task is the analysis of data to create and develop education to avoid improper payments and to reduce the national improper payment rate. Education based on data is quickly becoming more and more prevalent. If you've looked at any of the advertisements for our upcoming events, you're going to see more and more of them based on data. We don't just deliver our education, we must also analyze the results and then provide back to CMS the results of our education in those reports that CMS requires us to submit. So a lot of reporting going on in the background. Now, based on these directives in the IOM, you can view the education topics that we plan to host on our live events webpage for the remainder of 2026. We plan to offer education topics such as evaluation and management, or E&M services. Nearly 40% of all Part B claims include an E&M service, so it's not a big surprise that much of our education will focus on those services. We also plan to host webinars about telehealth, preventive services, self-service tools, and provider enrollment. And of course, we sprinkle in a plethora of other topics based on data, needs identified, and on provider survey feedback. That's why it's so important for you to complete those surveys and let us know about your wants and needs. We do meet every month to forecast our upcoming events, and we do this well in advance. Right now, we have already planned events into June of 2026. Some team members have added their items to our POE calendar for the remainder of the year. Now, this doesn't mean that those events are set in stone. It just means that these are what we're planning to provide education on. Of course, that could change depending on when CMS comes knocking on our door for a new initiative or something that's changing. But for the most part, we're planning way far in advance. All right. Here are some more CMS-defined POE tasks. They do expect that the MAC, the Medicare Administrative Contractor POE teams, provide focused education on new or for new or small providers, and also on the list is development of education for widespread dissemination. You've likely seen some of our handiwork in website articles, news items, on Facebook posts. YouTube videos, and even more. CMS provides direction for establishing and maintaining a POE advisory group and for partnering with external entities. And I'm going to expand on these on the next couple of slides. In section 20.6.1 of chapter 6, CMS does provide direction about establishing and maintaining POE advisory groups, or POE-AGs. In the IOM, CMS addresses the purpose of the POE-AG, the frequency of meetings, and other expectations, and more. The primary function of this group, this advisory group, is really to help the MAC create and implement and review provider education strategies and efforts. Members provide input and feedback on training topics, provider education materials, and dates, and when applicable, locations of provider education workshops and events. Now, this group also identifies salient provider education issues, and they recommend effective ways for us to disseminate information to all appropriate providers and their staff. We do meet 3 times a year, and when we're able to meet in person, CMS requires that we offer teleconference or video conference capabilities for all members who can't be there in person. The IOM also addresses group size and diversity of providers in this advisory group. The IOM also states that we can't reimburse or charge a fee for members to be a part of this group. There are no membership costs. CMS also instructs that the provider outreach and education team must distribute POE-AG meetings, the times and agendas, which do include discussion of topics that we solicit from members. And CMS also requires that we post those meeting minutes on our provider education website within 30 days of that meeting. Currently, we have a Part A POE-AG and a Part B POE-AG, and if you're interested in membership, you can send us an email request to join. While multiple people from one provider group are welcome to attend our meetings, we do consider only one person per group as the actual member of the group. It is our expectation that that member would then forward any POE-AG related communications to those members or others within their organization that are interested in this function. I'll show you where you can find information about POE-AG when I do a little tour of the training center in just a bit. First, I want to talk about partnering with POE. You can find CMS's definition of a partnership entity in the IOM. It's actually section 20.2 that defines the entities. They're defined as medical, professional, or trade groups and associations, some government organizations. Also considered a partner would be educational institutions or specialty societies and more. CMS does provide directions for how we must establish and maintain partnerships with these entities, and also not just with those partnering entities but with other MACs. MACs do so to facilitate the dissemination of Medicare information that's going to assist our providers in submitting correct claims. So there is that expectation that we'll provide information to these partnership entities, but they in turn will help us distribute information to providers or those with a need to know. This will assist us, or assist providers rather, this partnering effort in submitting those correct claims that we're looking for and in following regulatory requirements for documentation when ordering or referring certain items or services. Now, CMS does expect that for our events and activities, that whenever feasible, we will coordinate with other Medicare contractors and entities, including those quality improvement organizations, state health insurance assistance programs, end-stage renal disease networks, other interested groups, organizations, and CMS partners. So every month, CMS requires us to report information about our endeavors, including these partnering efforts that are related to education on items or services with the highest improper payment rate. So there is more guidance for partnering in the Internet-only manual, and in the interest of time, I'm sharing only those major tasks with you. For those of you that do represent a Medicare partner, we'd be happy to assist you with your training needs. We'll soon take a look at our training center content, and I'll show you where you can find our guidelines and our partnership request form that you need to complete and return if you are requesting a partner event with WPS. When sending the form, it is very important for you to ask your members to identify their wants and their needs. You can do so right on the form that you send in to us. We do appreciate advanced questions. That helps us develop our training materials, and it also enables us to gauge how much time we're going to need to provide that requested information. It also gives our presenters an opportunity to ask for help from another department or to do some research for those very complex questions that we sometimes receive. I want to talk next about POE collaborations. Our team does provide representation at many CMS work groups and task force meetings, and a couple examples of these are the Medicare Learning Network National Provider Education Work Group, and also the CERT AB MAC Outreach and Education Task Force. We also attend or present at CMS meetings with their partners like the state medical associations and state hospital associations, and sometimes we even speak at CMS sponsored conferences. We also attend meetings with other WPS departmental staff or WPS sponsored meetings. We work with our internal staff in various departments to accomplish the outcomes that are shown here on the bottom of this slide. One example of a WPS sponsored meeting that POE attends is the Contractor Advisory Committee, or the CAC, which is a group that is instrumental in the development of local policies. In Chapter 6 of the IOM publication for that customer service plan or provider customer service plan, CMS does address those tasks that are the responsibility of those in the provider contact center, otherwise known as customer service. I'm going to pause for just a moment. Thanks for hanging in there with me. Now, CMS does provide direction and requirements for responding to telephone and written inquiries, including those that are complex. In addition to those requirements, the IOM speaks to reporting, and it is our customer service representatives who must log, track, and respond to the inquiries that they receive based on those CMS directives and requirements in the internet-only manual. So responding to provider and claim-specific questions does require access to certain claims processing history. Our customer service staff has access to this so they can handle and report outcomes to CMS based on those CMS directives. This is not a POE task based on those instructions and directives in the internet-only manual. Handling those inquiries, like I said, is not a POE task. CMS does address the triage process for provider inquiries also in section 30.3 of the manual. So if you're looking for instruction on that, you can look to the manual. Just a little bit about why we do what we do and why we don't do what we don't do. Okay. There is some information in the IOM, instructions specifically for call center staff, not post staff, that does address responding to coding questions. We often receive these kinds of questions or telephone or written inquiries in POE, but it is a customer service responsibility based on those directives. And also based on those directives, MACs are prohibited from offering coding advice. We can't tell you which code to choose and report on your claim, but CMS does provide the MACs with the entities to which coding questions can be and should be directed. And to find this, you can access the link that I provided on slide 6 and refer to section 30.3.1. And if you're in the manual, that's section 30.3.1. I'm going to open it up a little bigger for you. I'm going to do a control F to find 30.3.1. You can see I entered that up there in the search. or the find box. This is where it tells us, tells Max specifically, that providers are responsible for determining the correct diagnostic and procedural coding. And it says that our customer service representatives need to refer providers with questions about coding to these 4 entities listed here. Okay. So we get that question a lot. Why don't you answer questions, specific questions? Of course, we answer questions about the training that we provide, anything that is presentation related, but we don't generally respond to unsolicited provider specific questions or claim specific questions for the reasons I just mentioned. So next, I've already talked about some of the responsibilities, why we do what we do, what are CMS's expectations, and where can you find that information? Where does it say that POE needs to do this? POE needs to establish and maintain an advisory group, and so on and so forth. Next, we're going to take a look at the training center, which is located on the WPS website. Now this slide shows a list of our training center contact. When you select the training center from the menu at the top of any WPS webpage, you will find tiles or cards for each of these items. I'm going to open the training center now. I've embedded links within your presentation handouts for you to make it handy for you to find these resources after this presentation today. I'm going to show you that I have opened the training center, but if you're on any page of the website, and I'm going to choose to click on this logo for WPS, which takes me to our home page, you can quickly find the training center by looking at the menu items at the top of any WPS webpage and choose training center. That takes you to those cards or those tiles for each of the items that are shown on slide 16. So I'm going to show you the content of our training center, and it's my team and myself responsible for much of the content here. Some people like to say we live here, we own this content, but this is content that we create and choose to publish based on those CMS instructions. Now we also provide widespread dissemination of education by using other portions or parts of our website. We also send out news items, and of course this would include any information that we publish out on that Facebook page. So a lot of things going on in the POE area. But let's take a look at live events, and you're likely very familiar with this page since you are listening to this live presentation today. This is our live events webpage, and you'll see that we have several webinars showing up here out through, I believe, the end of February, it looks like. Remember, I told you we're already looking at June and planning for June. And of course, the information or our schedule is subject to change, but for the most part, we're able to stick to those webinar topics that we choose, or we are told by CMS that we need to present. And you know, I had a lot of comments when you registered about, you know, what are your goals? And I told you about the goals, and that's really based on the information that CMS tells us we need to do. What is it we need to provide education on? But a big part of what we choose to provide education on comes from a list of topics that we have pulled from survey feedback. That's why it's so important that when you're completing those surveys to let us know how we did today or how we did in a webinar or at a partner event, that you're also telling us those topics that you want and need to hear about in the future. So keep that in mind. So this is our live events webpage. You'll notice that up here there is shows in green the J8 MAC Part B website. Of course, some of you might come in and look at our website and you might represent more than one jurisdiction, but you can easily move back and forth. Most of our education, though, and the information in the training center is going to apply to both parts A and B. So for the most part, these will be the same information that you're viewing. It doesn't matter what jurisdiction you're in. And when looking at a web page, you can see the jurisdictions that it applies to at the top of the page. All right, so that's live events. Back to the training center. Next is encore presentations, and encore presentations, of course, are those recordings of our live events. There's a chart here that contains our last and current quarter webinars. There's quite a bit of them. We keep really busy in provider outreach and education. This allows you to open a viewer and look at the recording or watch the video without having to view it in YouTube. Some of you have let us know, again, in those surveys, that we can't watch YouTube videos at work. So for about 60 to 90 days following an event, we'll post it out here as an encore presentation. So you can look out there if you missed and couldn't make it to one of our presentations. YouTube videos, of course, we have a list here of the playlists out on our YouTube channel. You can take a look at those. This speaks to the fact that for YouTube videos, we do not offer a certificate of achievement. The reason for this is that WebEx, our webinar platform, doesn't have a way for us to post those, the handout that goes along with the recording. There is a way, though, that you can get your hands on that content, and I'll talk about that a little bit later because that's one of our most commonly asked questions. And I'm going to finish up my presentation today with answers to those most common questions. A little bit more about the Training Center. Here is where you can find the information about partnering. I talked about partnering entities. These are the partnering entities. And again, we post back or we link back to Chapter 6 instructions on partnering. So says CMS. These are considered partnership entities. We've also included on this page education type. You know, are you looking for a teleconference? Are you looking for face-to-face? Face-to-face is not currently available, but when it is available again, we will update this page. Webinar, are you looking for some written material? You know, maybe you are tasked with writing an article for a newsletter within your organization. We can help you with that. This provides material or presentation length of the minimum number of people, and it also speaks to expenses. So just some good information here about partnering with WPS. Do you need to request a speaker? Here is some information about submitting that partnership request form. There's a link embedded so that you can open up and view that partnership request form. And I talked about this earlier. It's really important when you're submitting that form to us. I'm going to open it up here. That you fill out this portion of the partnership request form. Let us know the wants and needs of the members or the learners that will be participating in this event. Very important. We can let you know or commit to a presentation 6 months out. So just recently we received a request for a presentation in November. I have penciled it in on my calendar, but I can't commit to it until 6 months before November. So just some tips there for you if requesting a WPS speaker. Back to the website here. Got ahead of myself. Back to our website, Training Center. POE was something that I talked about. A big part of what we do. We're coming up on a meeting next month, so we're working on planning our agenda and soliciting those agenda topics from our members. This talks about what is the POE advisory group. There's contact information here where you can send POE related inquiries. You might have heard me just call it POEG. Some people call it POEG as opposed to POEG. It's the same thing. Our next meeting is February 18th. And we are required, as I mentioned earlier in the IOM, CMS requires that we publish our meeting minutes and that we do so within 30 days from our meeting date. So you can see that our last POEG meeting was October 15th of 2025. You can open and view those minutes. We have a lot of great discussion during those meetings. We think our members are awesome. They really do work hard to help us create and plan our education and our education strategy. If you are interested in becoming a member, you can do so. Send us an email. And remember, we do allow one person per entity or organization to be the member. We welcome others to attend our meetings, but those folks that are the actual member are responsible for reaching out within their organizations or agencies and sharing our information with others. Back to the training site, or the training center rather. I'm going to skip over meet the team and come back to that in just a little bit. But here's a training overview, just some information about mass training that we do, how we complete our training. You can link to a page to meet our team. There's some information on here about our training indicators, training formats, and so on and so forth. A lot of good information. Little information about CEUs, and I'm going to talk about those in just a little bit because that's a really important thing that we get a lot of questions about, and so on. So a lot of great information there, just some general information, but really good information. I want to show you that we have a section of our training center that really is focused on our new to Medicare providers. I'm going to open that up. This tells you about some of the options that, or tells a new provider rather, some of the options that we have for new providers. There's a Welcome to Medicare packet available. You can sign up for e-news. You can look at our videos and so on and so forth. Check out our web pages, so on and so forth. And then we've, at the bottom here, linked to some CMS web-based training that's available. So some good information and a really good start for those that are new to Medicare. And last but not least, here on our Training Center webpage is specialty service training and resources. And this has kind of evolved, and a lot of it comes from that great survey feedback that we get. You know, people saying, you know, can you put together some specialty specific information or resources for mental health, for example. Recently, I just put together a number of CMS outpatient mental health resources, national coverage determinations, local coverage determinations, and then some of those great mental health resources that we have available on our website. We've also included at the bottom of this page a roadmap to behavioral health guide, a link to it, because that is something that would be helpful for you to provide your patients. We understand from some of you that sometimes it's a little difficult to explain what Medicare covers, what Medicare doesn't cover for certain service types, so I included that information there at the bottom of the page. All right, so we talked about most of the training center content. Next is this, 213. Time for a little fun. Can you guess what 213 represents? This little dog here on the slide thinks he knows. Looks like he's raised his hand to answer. But 213, any idea what that represents? If you want to have a little fun and we can gauge what you all are thinking, you know, throw your answer out into the chat. 213, what significance does that have? 213 is the total number of years experience for our POE team when I created this presentation, which was just a little while back, maybe a month ago, 6 weeks ago. There is currently 9 of us on our team, not counting our manager, and you can meet the team by checking out the card by that name, or tile if you will, whatever you want to call it, here on the Training Center webpage. Right here, meet the team. This is where you can see a photo and get some, you know, biographical information about each of my colleagues, our team members out that work in provider outreach and education. Okay, yours truly. Many of you, if you are attending other events today, have already had the opportunity to hear from a couple of my colleagues, and more this afternoon. Before leaving the Training Center webpage, I do want to point out something that we did to enhance our training webpage, or our Training Center webpage, some time ago, and that was the addition of this calendar for our upcoming events. That was an ask. in the survey feedback from our provider community. They wanted a quick to look at calendar of our upcoming education events, so you can find that on our webpage. And also some training frequently asked questions available here, and so on and so forth. I did mention to you earlier that we have a provider Facebook page. A lot of providers aren't aware that we have that Facebook page. It's just another great way to stay connected with WPS. If you're interested in that, you can hover over the Facebook icon here on the bottom, and that'll get you started. All right. So 213, that's a lot of years of Medicare. All right, the next portion of my presentation today is Get to Know POE, Cure for Cabin Fever. A lot of information that you can come back to and take a look at later. I do want to share with you some answers to common questions that we receive. And I say common, and these are questions that we do hear often. They come in over and over. I just showed you those FAQs out on the Training Center webpage. If there are folks within your organization or maybe someone new that joins your team, that might be something that you want to point out to them so they know where to go for answers. But I'm happy to answer some of them today during this presentation. Here's one often asked question: where can I get the handout? The handouts for our live events are available on our live events webpage. They're usually there about 5 days before the event. Shortly before the live event or after the live event, as I mentioned earlier, we're going to post that recording to the Encore Presentations webpage and on our YouTube channel. This is a question that I said I would answer later when I was talking about recordings. The Encore presentations that we post, those recordings, available 60 to 90 days following an event, for 60 to 90 days, I should say. They're out there just a few days after the event, sometimes right away. There is a link for handouts that posts with the video if you'd like to get your hands on the presentation materials for any of those Encore presentations. However, we're not able to post that handout out on our YouTube channel. So let's say that video is gone from the Encore presentations. You're looking at a video on our YouTube channel. You can send an email to our education mailbox, include the name and the recording date of the event, and that recording date is in the description for the YouTube video, and we'll be happy to send you that handout material. Here's another commonly asked question: can I get CEUs for WPS education? I mentioned to you that we use WebEx for our webinar platform, and following an event, a live event like this one right now, WebEx is going to send an automated email to those that attended. You can look for an email that's sent from messenger@webex.com. Now, in the body of that email is language that serves as a certificate of achievement. It's not an attachment. It is words that appear in the body of the email. Now, if you don't find the email, we recommend that you check your spam or junk folder. Your company may send emails such as those automated emails from WebEx to one of those folders. Now, if you find it in your junk or spam folder, one thing you can do is consider adding Messenger at webex.com to your safe sender list so that future emails are not sent to junk or spam. Did you join our webinar only by phone? If you listened only and you did not view the slides that we shared during the webinar, you're going to receive an email from WebEx, but this email is going to say, "We missed you. Sorry, we missed you," something like that. The reason for this is that you did not provide your telephone number when you registered, so WebEx doesn't recognize the phone number that shows on those attendance records that they share with us for reporting purposes. Now, if you join one of our webinars by phone only, you're listening in, you're following along on the handout, and you need or you want a certificate of achievement to keep on file or to share with an accrediting body, you can send an email to the address shown here on this slide. slide. That's our education mailbox. Include the event date and the name and that 10-digit telephone number that you called from. We will verify attendance on those WebEx reports, and we'll send you an email that includes the certificate of achievement verbiage in the body of our email. It's not a separate attachment. It's actually embedded right within the language in that email, and there's an example of it on this slide. Just to expand a little bit more about CEUs, WPS does not provide you with a tracking number to use to request CEUs. This slide is here to provide directions for obtaining CEUs. You need to send that certificate of achievement, and remember, it is in the body of an email, to the accredited choice and ask them to consider awarding CEUs for the WPS education that you successfully completed. Now, if you're asked, you can let them know that WPS is a CMS Medicare Administrative Contractor, or MAC, and you can find more details in that training overview on our website that I showed you a little bit earlier. We have gotten some questions about what purpose do the chapters in our YouTube descriptions serve. This slide addresses that. Chapters are clickable time code sections that allow someone who is viewing one of our YouTube videos to move to specific content. When you're looking at a video, the video's progress bar is going to actually break up the chapters. You'll notice little breaks in that progress bar. This coincides with that list of contents, or chapters rather, that we call, is what we call them, in the video description. So for example, for this YouTube video, there are various chapters. If you want to quickly move to eligibility, you go using the video's progress bar, you can slide it over and move to 34 minutes and 38 seconds to get to eligibility. So this is just a nice way of helping you find the content that you are specifically seeking. Some have asked how to know if an education event that we advertise is suited to their needs, and we include training indicators in our webinar descriptions. Now, this and chapters were just a couple of the enhancements that we made or changes that we made, and it's based on that survey feedback that we ask you for each time you attend one of our events. So very important. The training indicators explain the intended audience, and I've asked Jennifer to place the link in the chat, and I'm going to show you how to find those training indicators. So if you're out on our website or on the Training Center webpage, I'm just putting into the search box. I see I started typing training, and right away I get some predicted results that match. What is a training indicator is what I'm going to choose. It's actually in one of the FAQs out on our tools webpage. What is a training indicator? We use training indicators to help you determine if the training material applies to you. You can actually click and view a list of those training indicators that we placed on our website. So if you are a provider who bills on the UB04 claim form and you see FIS, F-I-S-S, as one of the training indicators, then you'll know that that material that we plan to present is applicable for you. There's Part A, there's Part B. You can see that we have CLIN as a training indicator. It means clinical. NTM means new to Medicare. I talked about the fact that CMS requires that we provide education for new providers or those new to Medicare, so on and so forth. I want to point out the S with the number. This will change. It might say S1 or S4, S10. This indicates that that event is part of a series. Okay, so it's series and then the event number within the series. One of my colleagues and I are currently offering or facilitating 12 mental health webinars. So you'll see that S with a number on any of those advertised events to let you know that it's part of a series. And again, you know, if you're not able to get to all of them and you'd like to, you can listen to them for 60 to 90 days on our Encore Presentations webpage. And then, of course, that video will be available on our YouTube channel as well, provided that there are no technical issues with that recording that we did. We have had a couple of situations where it has happened that the recording, for one reason or bad, you know, was gargled or something, garbled. You can't hear it properly. So we make a choice then not to publish that. So that's training indicators. Suggestions for education, and I've really hit upon this a lot because we get some great suggestions from you. We don't know your wants, your needs. Even something that may seem very, very simple is often something that means so much to the provider community or staff within an organization. You know, can you show us how to use the National Correct Coding Initiative edits? Sometimes it's a tutorial or a demonstration that you're looking for, but we really want to know what can we do to meet your needs, and you can suggest a topic by sending an email to our education mailbox, or you can include it in that survey feedback that we always ask for. We do have a dedicated education mailbox for the reasons shown here on this slide. Now, as a general rule, use this mailbox when we invite you to do so, or when you need to ask about a training event, request a partner event, or ask a follow-up question, or respond to a team member's response. Sometimes we'll reach out to someone and we'll ask you to send a response or send something to us in that mailbox. This mailbox is not used for submitting an unsolicited question. Those are handled in customer service. They will log, track, and respond based on their directives in that IOM. But this is all things education, all things POE, not customer service. This then brings us to some time for presentation-related questions about today's event. So I am going to throw it out to Jennifer to see if there are any questions that have come in the chat. Anything about POE that you'd like to know?
We did receive one question. I did answer the provider privately, but I think it might be good information to share about providing in-person education and the travel ban and whether we know when it's going to end. If you could just briefly touch upon that, because I think it's good information for everyone.
Oh, I agree. For those of you that are not aware, all health and human services agencies are currently under a travel ban that has been since early 2025. We have approached CMS about the fact that we have received invitations from some partner organizations to come out and do in-person presentations. We also were actually in the midst of planning some face-to-face events like we have done in the past, some of those large events. A day with Medicare, we used to call it, and then the other one just escapes my mind right now. We do not know when that travel ban will be lifted. We will await, hopefully sooner than later, word from CMS that that ban has been lifted, but we don't know if or when it will be lifted. But as soon as it's lifted, you will all know, because we will certainly update the information on our website in the training center. Remember where we talk about those face-to-face events that you can request. But at this time, no, we are unable to travel. Hopefully we will see your smiling faces in the future, and hopefully it'll be a lot warmer day when we do it. Any other questions, Jennifer?
No, thanks, Mary. That was a great explanation. I do not see any other questions in the chat at this time.
All right. Well, here it is, folks. Time that I talked to you about the survey, and I know that I've mentioned it and talked about it. You've got a few extra minutes left before the next presentation starts at the top of the hour. You don't have to take this survey now. You can do it later, but we do ask you to please take a few minutes to complete our survey. Tell us what you liked, what we could do better, suggest topics for future education. Your feedback really is invaluable. It ensures that our education is timely and effective. That's one of the things CMS says. Make certain your education is timely and effective. That's why we do what we do. I've explained that to you earlier and showed you where you can find that information. There's so many different options for this, or a few different options, and it really depends on your preference. You can use the link in the chat, or when you exit the webinar, you're going to be asked or directed to an external site. You'll see what you see on the top right side of this screen here. It is a white box with a yellow triangle at the top and a blue button. This is when you click on that button that says continue on it, you can you'll be directed to the CMS Qualtrics survey website, where you'll be able to complete that survey. That is so important. CMS expects that our providers will complete these surveys. That's why you hear us asking you to complete them. We want CMS to know we are being diligent in our efforts to get feedback from our providers. It's important. It lets us know how we are doing. It lets us know what we can do in the future to meet your needs and your wants. Now, if you're like me, you might be one of those people that sat through this presentation to learn about POE and why we do what we do, where you can find some great information that we placed out there about all of those responsibilities that we have. You might think of a question in the next couple of days that you wish you would have asked. You still do have an opportunity to send that question to us. But in a few minutes, you are going to receive an email from WebEx. It's going to include in the body of the email that language that is your certificate of achievement. It includes the name of today's event, the contact hours, which is 1 hour, and then of the date. That's that email that you need to present to the accrediting body of your choice so that they will consider awarding you with CEUs. I mentioned questions to you that you might think of something, a presentation related question pertaining to this session. You have 7 days from now, or up to 7 days from now, to submit that question to us. And this is one of those situations, folks, where you can send that email to our education mailbox, wps.gha.education@wpsic.com. You'll find that email address sprinkled throughout the presentation. That's the email address that you can use to send me a question about today's presentation. If you joined us by phone and you need CEUs, or you want that certificate of achievement, you can use that same email address, provide that 10-digit phone number, the name of this event and the date, and we will send you an email. WPS will send that one if you join by phone, not WebEx. It will send you that email and include the certificate of achievement language. But you have 7 days for those follow-up questions. If you can think of anything, I'll be certain to either answer you directly or create a list of questions and all the answers and send them out to all of you. Jennifer, back to you. Any questions that have come in?
No questions in the chat.
All right. Well then, folks, I'm going to give you a few extra minutes before you need to get off to the next presentation if you are participating in that. On behalf of myself and Jennifer and all of Provider Outreach and Education, I do want to thank you for attending our webinar. We look forward to those survey comments. We hope you will join us for future webinars. But this does include our webinar today. You may now disconnect. Stay warm, folks, and have a wonderful day.